The information contained in the SSI Spotlight series is designed for and intended for use by the NCAA membership. The webinar content represents the views and opinions of the participants and does not necessarily represent the views or opinions of the NCAA. The content has been made available for informational and educational purposes only. The NCAA does not make any representations or warranties with respect to the accuracy of the content, nor is the content intended to be a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The webinar is intended for personal viewing only and may not be recorded.
Hello, everyone. My name is Dr. Dina Casiro, NCAA Chief Medical Officer and Senior Vice President of the Sports Science Institute. Welcome to this SSI Spotlight on the NCAA Drug-Testing Program. The NCAA Drug-Testing Program, along with clear policies and effective educational programs, contributes to a campus environment that supports healthy choices, fair competition, and a positive environment for student athletes. The NCAA drug testing program exists to, number one, ensure the integrity of competition, number two, deter the use of performance-enhancing drugs, and three, promote student-athlete health, safety, and performance. You'll see a QR code that you can scan for more information on the NCAA drug testing program. The NCAA list of banned drug classes is composed of substances that are generally purported to be performance-enhancing and or potentially harmful to the health and safety of the student athlete. However, the NCAA recognizes that some banned substances are used for legitimate medical purposes. Accordingly, the NCAA allows exceptions to be made for those student athletes with a documented medical history that demonstrates the banned substance is needed as part of an approved medical treatment or therapy plan. Today's session will include an overview of the medical exceptions process. Relatedly, effective January 2025, all medical exception requests for pre-approval, or MEPAs, and continued use medical exception requests must be submitted through the NCAA Requests Self-Reports Online system, or the RSRO system. While the method used to submit, track, and stay informed on the status of a request is being streamlined through RSRO, the protocol and related documentation will stay the same. This effort serves to modernize the method used to collect medical exception materials to provide greater efficiency, clarity, and historical record for the process. Visit the NCAA website to learn more about the process, including tutorials on how to submit requests. And now I'd like to welcome our two guests for today's discussion. Jack Entrekin is the Director of Sports Medicine at Kutztown University and is a member of the CSMAS Drug Testing Subcommittee. And Dr. Marie Schaefer is head team physician at Cleveland State University and chair of the CSMAS Drug Testing Subcommittee. Thank you both for being with us today. I welcome both of you to tell us more about yourselves, including your role and relevant experience as it pertains to today's topic. Jack, let's start with you.
Jack Entrekin, as Dina said, Director of Sports Medicine at Kutztown University, which is in Pennsylvania. Been here for 32 years, been a Division II athletic trainer for 37 years, and certified for 37 years. My role with CSMAS is primarily on the subcommittee of drug testing. Been on that committee for 2.5 years now.
37 years. Wow, Jack. All right. Go ahead, Dr. Schaefer.
Hi, I'm Marie Schaefer. So I'm a sports medicine physician at the Cleveland Clinic, which is in Cleveland, Ohio, where I'm also the head team physician at Cleveland State University, which is a Division I school in the Horizon League. I'm also in my first year as one of the physician members of CSMAS, and I'm the chair of the drug testing subcommittee, and I'm also a member of the drug test appeals subcommittee.
Well, thank you both so much for joining us today. I think it's fantastic that we have two members of our drug testing subcommittee here to talk about the NCAA drug testing program and the medical exceptions process. So we'll start off a little bit with you, Marie. Can you talk to us a little bit about the role of the drug testing subcommittee and give us some examples of past or current work of the committee?
Yeah, no, thank you, Dina. So the role of the subcommittee is we work on approving and evolving all of the policy changes and procedures for drug testing as science changes, new trends occur, new substances come on the market. For example, GW 1516, which was a metabolite in one of the banned hormone and metabolic modulators, we found that it was stayed in the system for a really long time, and we needed to lower that threshold so that people weren't unnecessarily held out of their seasons. Our overarching goal of the subcommittee is, as you stated in your introduction, Dina, to provide fair and safe competition for all of our student athletes. And this also falls to our committee to work on that education piece when necessary. For example, with the recent cannabinoids changes, working on our harm reduction strategies and education surrounding that as well.
Yeah, that's fantastic. I remember I was on the committee when we were talking about GW 1516 and lowering that threshold, and what an impact that those changes make on student athletes. You mentioned student athletes were being held out for sometimes years until that substance was out of their system. And the drug testing subcommittee did such great work to really look at the fairness, the fairness piece of it and say, hey, does this really make sense, or does lowering the threshold here better serve the student athlete? So I appreciate that. So Jack, my next question is for you. NCAA legislation requires schools to educate their student athletes about banned substances and the products that may contain them. Can you talk to us a little bit about what strategies you or your campus might employ to educate student athletes about banned substances?
Here at Kutztown University, we start with our medical procedures process. So asking students what medications they take, what have been prescribed to them, what they're taking, hopefully maybe off the market stuff, but getting the list of what they're using and then reaching out to them for further information. When they arrive on campus, we do a preseason meeting with every team. We talk about drug testing, the banned substance list. We give them access to that through their student handbook, which has been developed for many years now. And now it's online, so they just have links they can get to different aspects of the drug testing system, the banned substance list, and also we educate them on how to use Access. So if they have questions, they can always come to the athletic training staff, but they can also make an account in Access and look up substances that they're using, somebody's offering to them. But the number one process, or the number one thing that we emphasize, is you're responsible for what you put in your body. So before you do that, talk to somebody on our staff about what you're going to use. In addition, we have another conversation postseason when we get into the playoffs. We go over this all again. This is the time where the NCAA could come in and drug test you again. So we talk about the banned substance list, Access, reach out to our staff if you have questions.
Yeah, that's great. And I think I'll ask you a follow-up question there. You mentioned Access, right, which is the educational platform that's maintained by Drug Free Sport, which is the NCAA designated drug testing agency. Can you talk to us a little bit more about what Access is, the functionality of it, how you use it, and what sort of messaging you give your athletes when they get an Access report from a particular substance that they might be using?
So I'll start with the last first. The report that you get will come in 3 distinct levels. They'll label something as a level 1, a level 2, or a level 3. And we tell our athletes, if it ticks any of the levels, you shouldn't use it. What we see a lot of times are the level 2s in substance that are using, even stuff we might have in our vending machines on campus might tick a level 2. So, let's not get involved in those things. Access is a platform that you can easily reach out to somebody. I believe WADA uses this platform also. So basically you put in what substance you're using. You'll get a notice, and typically in 48 hours, might be a little bit longer on their backlog sometimes, but we're really getting to see what level a substance may be. And if it ticks a level, you shouldn't be using it.
Yeah, I appreciate that. I remember when I was on campus and we would talk to student athletes about the different levels, we would always say there is no level that is a zero risk category, right? Access does not ever say this particular supplement is 100% safe for you to take. There's a risk with potentially anything that you put into your body. And so I think that that's a good message. So Marie, we know that supplements can pose a risk to student athletes due to possible contamination with banned substances. So what is CSMAS's view on supplements, and how do you educate your student athletes around supplement use?
Great question. And I think, the overarching theme is going back to what Jack said, that the student athlete is ultimately responsible for everything that they ingest. And, this is not something that's commonplace knowledge, even in, my regular patients that I see, that supplements are not regulated in the same way that, other medications or things are regulated, so that they can have these additional substances in them. And, there's no one necessarily looking over, these manufacturers' shoulders and telling them what to put in there. So I think that's kind of the overarching theme. When I try to educate, my student athletes, it's looking as to why do they feel like they need this type of supplement, or what is missing. And CSMAS and the NCAA likes to focus on that food is nutrition, and this is where we're going to get our supplements for. Many campuses have lots of great resources to nutritionists and dietitians and meal prep programs. And, certainly as a team physician during my pre-participation physicals, I like to go through supplements, just as Jack said. And, we're working with a young population. This might be the first time they've ever been to the doctor by themselves before. And I think it's really important to, explicitly say, what supplements are you taking? What other pills are you ingesting? People forget their birth control pills as a lot of times as a medicine that they're taking. So I think that really, highlights the need to, you have to really probe as a physician in that situation.
Yeah, I totally agree. I remember I would always say, are you taking any medications? The answer was no. And then it would come out with an albuterol inhaler, birth control pills, right? These are things that people don't think of. And I think it's the same thing with supplements. I think even if you're taking a magnesium supplement or a fish oil supplement, you might not think this is what the doctor is asking. And so I think it's important to ask those follow-up questions. And I love your comment about food first, right? I think that that is a really common sort of stance, and certainly what CSMAS really talks about, and that there are no approved supplements, right? So there is no list of supplements that are approved by the NCAA. They all come with this inherent risk. So another question for you, Marie. There are a number of reasons why a student athlete might fail a drug test. Contamination, as we mentioned, is one of them. But the drug testing program does have an appeals process. So what is that process, and how does it work?
So yes, no, absolutely. So the appeals process is well laid out on the NCAA website. So I always wanted to reference people back to that, because there's, a number of forms and quite simply checklists on things that need to be submitted in order to have that drug test reviewed by our appeals panel. And so our appeals panel, so once the information is submitted to the NCAA, it goes to the NCAA staff to review, and then a drug testing appeals panel is convened, and we will pretty meticulously go through the material provided, make sure that we truly understand the story and the circumstances around the reasons that the student athlete or the school is bringing back to us as the reason for the appeal. And then we go through the process. And I want people to really understand that this is not something that we take lightly, that the people on the panel are not, it's a variety of people from all across our CSMAS membership. And we all bring different levels of expertise, and it's a very comprehensive look at the situation. And we do take it very seriously. And I've seen appeals go both ways. And so I think it's important to know that there is a process, and that it's really thoughtfully done by the people on the other side as well.
Yeah, I appreciate that. I used to sit on that committee, and I agree with you. I think that every single case is taken very, very seriously. There is a lot of extenuating circumstances and individual circumstances that fall into these cases. And so I think having a thoughtful group of people that sit on this committee is really, really important. So appreciate you sharing the perspective on that. So let's talk a little bit now about medical exceptions. So let's just start with the basics. And Marie, can you talk to us about what is a medical exception request?
Yes. So a medical exception request is needed when a student athlete uses a banned substance for a legitimate medical purpose. And there must be some type of medical reason why that banned substance that you normally should not be able to use and can be considered performance enhancing or banned needs to be used. And this happens, they are medicines that I will use in other patients, regularly. But with our student athletes, we hold them to that higher standard. So we really do encourage student athletes before committing to obtaining a medical exemption request that they work with their healthcare provider to see if there's any other type of medication or treatment option that they could do, because it is burdensome both in a paperwork perspective and having to think about it as well.
So talk to us a little bit about the difference between a pre-approval and a continued use request for a medication that might contain a banned substance.
Yeah. So the way to sort out which process that you need to go through in this whole medical exemption or medical exemption pre-approval process is based on what that substance is. So substances that require a medical exemption pre-approval, and I'll keep saying it because it gets like there's a lot of ABCs here, and we call them MIPAs. You need those for things like anabolic agents, hormone and metabolic modulators, peptide hormones, growth factors. So you need to get this approved prior to taking that banned substance. So the school, what they need to do in these situations is they have to submit a diagnostic evaluation, laboratory values, a treatment history, what the medication is, dosage. Again, all of this is found pretty clearly on a checklist on the forms in the NCAA's website. And then once that paperwork gets submitted, it then gets reviewed by a medical review committee, which includes 5 different physicians that go through each of these MIPA requests. So that's on one hand, the MIPAs. So on the other hand, you have your medical exemptions. So these are things that you have to get approval for after you test positive for a drug test, which is a different category of medicine altogether. So these include stimulants that are used to treat ADHD, which, as we know, are probably one of the most common banned substances that our student athletes use, along with beta blockers or beta-2 agonists, diuretics, and narcotics. This is now the category that spironolactone fits in. Previously, it was in the MIPA category. This was the big move this year, is that it's now moved over to this category. So if the student athlete uses one of these medications and they test positive, then they need to, the school will then need to request a medical exemption, which includes similar paperwork to the MIPA. You need to have the diagnosis, the treatment history, your medications, kind of the last date of the prescription, those types of things. And so once either of those scenarios occur, then you kind of go into this continued use pathway. So that now at least twice a year, you have to submit paperwork that confirms the diagnosis and confirms all of these things. And those twice a year information updates, one has to occur before your competition season. And so the school works with the NCAA in turning in those forms, which will be a lot smoother through the new process that's being rolled out as well. So those are the 2 different classifications, and I really have appreciated the NCAA staff has been so good at making sure all that information is collected. They keep everything, and when it gets to our 5-physician medical review panel, then we're able to have all that information we need to make those decisions quickly for our student athletes, because certainly time is of the essence in many of these occasions.
Yeah, that was a phenomenal review of the different categories. And so I think what I'm hearing is that if schools, when they're submitting, they're asking their student athletes to gather as much supporting medical information as they can, right? Like you mentioned, doctor's notes, you mentioned prescription dosages, timelines. So it sounds like the more they do to collect that information on the front end, the more successful they may be in terms of getting those requests approved.
Absolutely. And I really, really encourage schools to find the NCAA medical exemption documentation reporting form and look at those checklists on what you need, because I've noticed that that can be where a lot of the decisions get held up, especially with the diagnosis of ADHD, understanding what you need to, what kind of documentation. And you might have to go, the student athlete might have to go back pretty far to get that documentation. So I agree with you, getting all of your ducks in line at the beginning of the year is essential. And it's something that, at my institution, we have a checklist every year. So we know which student athletes we need to collect whose paperwork on, so that, we're not scrambling last minute here.
Yeah, that makes sense. And you mentioned that the panel that reviews these are all physicians, right? So these are medical professionals that are really digging through this paperwork and coming to the conclusion as to whether or not the supporting documentation really supports the approval of that request or not.
Absolutely. And they're also the makeup of the current panel. We have psychiatrists and endocrinologists, orthopedic surgeons, sport and exercise medicine physicians. So there's a lot of clinical expertise, and I think it's been really helpful, because you think every scenario, and then a new one pops up, and it's unique every time.
Yeah, no, that's definitely true. So Jack, can you talk to us about some common missteps or challenges with requests that you've seen come in and how schools might address these?
I think I'll use our school experience. Like I said early on, the medical history is the most important part, and having kids list the medications they're on. And then, for the ADH kid, we will backtrack with them if they don't submit the information we ask for, which we have that process already in our medical forms procedure prior to them coming to campus. And we have to be on top of reviewing the medical history. If they list a drug that we know that's typically used for, let's say, ADHD, and they didn't complete the other side of the paperwork, then we have to, get them involved in, hey, this is a process you need to be involved in and get all this information for us. Because if you are tested and test positive, we have a limited amount of time to produce and get this information to the drug testing committee. So I think that's one of the biggest missteps, is not doing this ahead of time, and student athletes not understanding how important that procedure is. And at a Division II institution, we don't normally have the staff to, or I should say, across Division II and Division III, we don't have the number of employees to really harp on kids to get all this stuff done. So the preset of medical paperwork is really, really important, because once the fall season hits, it's very hard to stay on top of that information gathering.
And I think the other piece to that, Jack, that folks don't think about on the front end is how long it takes to get some of this information from the treating physicians, right? So if that student athlete is, at your school and their treating physician is back in their hometown, now they're trying to reach out and wait to get information, and that takes time. And there's a lot of back and forth that goes on campuses. So I agree with you that the more work that's done on the front end, the less pressure that everybody feels as a positive drug test comes in to try to have to prove something that you could have had all those ducks in a row ahead of time. So I think that makes a lot of sense. Well, before we wrap up, I would love to give you each an opportunity. If there's anything that you wish that schools knew about the NCAA drug testing process or protocols. I know I felt like when I was on CSMAS, there were so many things about the drug testing program that I wish that people knew about. So anything that jumps to mind for either of you?
One of the things that jumps to mind for me, being on this committee for 2.5 years and listening to appeals, is the athletic training staff, sports medicine staff, however we want to categorize it, the athletics personnel really documenting how and when you educate your student athletes. We've
Great
seen a
point.
number of cases come through where the student athlete will say, I wasn't educated, I wasn't given this information. And then somebody on the sports medicine on the athletic side says, yes, we do this. We have a team meeting, but maybe you didn't take role at the team meeting. So, everybody who tests positive and sets an appeal up are going to look for an angle to get through the appeal process, whatever that may be. And I think documenting your educational process to the student athlete is really, really important.
Excellent point, Jack.
No, and I agree with that. I think that's been probably the number one thing I've learned in my short tenure is that it is documentation is everything. And I think the thing that was very surprising to me is that, prior to doing this role, this seemed a little bit of a black box. Like, where am I submitting this to? Are the, who are these people? And we are really are real people back here, and we really care about it. And I'm always rooting for the student athlete, but also, with that, that hat on, that this needs to be, this needs to be safe. This needs to be fair for everyone. But there is back and forth that you can have, like, if there is, a piece of information that we're missing, we're not just going to throw something out. No, we're going to ask the school about it. Like, we're really trying to do our due diligence to get the story, and it aren't going to, be punitive for things that are, not the student athlete's fault or, not the school's fault. We want to be as, fair of a process and as transparent a process as we can be.
Yeah, thank you so much, both of you, for joining us today. What a treat for the membership to hear about the drug testing program from two members of the drug testing subcommittee. I'll also say that these folks are volunteering their time to be on this committee. They're not getting paid to do this. They're doing this because they care about it. And I think your passion for this, Jack and Marie, really came through on today's call. So thank you so much for your continued dedication to the health and safety of our student athletes. We really appreciate you. And I want to say thank you to our audience for attending today's session. Hopefully we answered some of your questions regarding the NCAA drug testing program. Don't forget that your certificates of attendance are available. You'll find instructions in the chat, and they'll be sent to your email within 24 hours. Please email ssi@ncaa.org with any questions or suggestions, and we look forward to seeing you on our next SSI Spotlight.